Welcome, everyone, to the next installment of our series providing the information you need to know as the COVID-19 pandemic designation finally comes to an end at the federal law level. I'm excited to present to you today. So my name is Bryan Meek, and I am the co-chair of BMD's Labor and Employment Practice Group. As many of you in the presentation likely remember, I have been focused on employment and COVID issues dating back to mid-February of 2020, when we first started hearing what social distancing was, obviously a term to many people at the time, myself included. So from the start, we've guided our clients through the initial stages of COVID and, including protections and leave policies for your employees. We then shifted to vaccine requirements and all of the issues such as mandates brought to your workplaces. We now get to shift to taking you out of the pandemic, and I cannot be more excited about that. But before we jump in, I do want to do a quick self-plug for our employment law YouTube channel called Employment Law After Hours, which is free to subscribe to. If you're the type of person looking for quick education on the need-to-know issues in employment law, but you prefer to listen or watch rather than read, such as I do, this type of video podcast is for you. Now, although I am a lawyer, I may not be your lawyer yet. Therefore, I have to include this required disclaimer that's on the screen now so that any information presented here today is for educational purposes only, and any questions that you may have should be phrased in a hypothetical, curiosity type manner. If you're an existing client or would like to further speak about one of these topics, we could certainly schedule a conference call after the presentation to ensure the specific information being presented is protected under attorney-client privilege. So one final note, this webinar is being recorded and it will be emailed to all registrants along with the slides for today's presentation. So let's now dive into the topic of the day. The Biden administration will formally end the COVID-19 public health emergency, otherwise known as the PHE, on May 11th, 2023, about a week from now. Throughout the pandemic, the government, through statutes such as the FFCRA, the CARES Act, and even changes to HIPAA, along with a few handful of federal departments and regulatory agencies, have all made various adjustments to certain laws and regulations to respond to COVID-19. These adjustments are scheduled to end with the public health emergency next week, but some will last a little longer or remain permanent, which we're going to discuss here today to give you that information. So the emergency declaration's expiration, that's occurring next week, also has several effects on health insurance and retirement programs, which raised requirements and improved freedom for employees during the pandemic, to allow them additional time to register or make certain changes. Those are going to come to an end as well. We're going to discuss those. So just kind of at the forefront, I do want to say you'll want to meet with your plan sponsors and administrators to review your plan documents and previous employee communications that you've sent out concerning, changes to your policies and insurance because of the anticipated termination of the, PHE on May 11th. You're going to want to make sure that any changes or notifications that you previously sent out, are corrected or, new information is presented that may be changing for your specific policies and programs with your insurance provider. Only your administrators and sponsors will be able to provide the specific information to you. But just for a quick example, the two we're going to discuss really in depth today, two existing COVID-19 orders that are going to impact the health plan. The first is the PHE itself, which was renewed by the Secretary on January 27th, 2020, and affected requirements to cover COVID testing and related services, essentially requiring that these services and testing be provided free to your employees. The second order, however, was in 2021 and made by the Department of Labor and the IRS in conjunction with one another. This directive told the deadlines for different health plans until the earliest of, one, the person's first eligibility for deadline relief, and number two, 60 days after the end of the national PHE, whichever comes first. Obviously, the second one is now going to come in place, going to affect a lot of plans. We're going to get into that here today. So the outbreak period that a lot of these statutes default to revert back to pre-COVID days is 60 days following the end of the COVID-19 national emergency period. Thus, because the administration has announced the end of the PHE on May 11th, the anticipated end for most of these statutory plan provisions will be July 10th, 2023. So in other words, 60 days after the expiration of that PHE. So furthermore, with the end in sight of COVID, there's now a great need for employers to focus on coverage changes and winding down through the deadline extensions. Finally, at the end of this presentation, we're going to discuss some breaking news regarding the COVID vaccine mandates that came out just this week. So you want to stay tuned for that. As I'm sure most of you will remember, during the pandemic, under the Families First Corona Response Act, group health plans and health insurance providers, including those with grandfathered health plans, were generally required to cover costs associated with diagnostic testing for COVID-19. This was obviously great news for employers that wanted to have their sick employees tested, knowing that those employees would not need to cover the cost. They removed that barrier to testing to ensure the workplace, stayed safe and healthy. So this obligation applied to any goods or services provided during the PHE, which is again coming to an end next week. So plans and insurers were required to offer this coverage without requiring, prior authorization, cost sharing obligations with the employee, or other medical management requirements that were required to be put in first before coverage applied. So thereafter, the CARE Act comes along and amends this first law to cover a broad range of diagnostic products and services without cost sharing, including the authorization, medical management, et cetera. So under this CARES Act, when the plan or issuer, insurance plan or issuer, and a diagnostic testing provider agree on a price for COVID testing, the plan or insurer must pay the provider that amount. And I'm sure there's some of you on the call today that may have had arrangements to do COVID testing for certain insurance plans. This is where we're falling right now. So if the plan or insurer and the provider do not have a rate agreement in place, the plan or insurer must pay the provider the cash price for the services that the provider lists. This essentially allowed the plan, the health insurance plan, to negotiate a rate less than the cash price with the provider that would normally be in place. You can kind of see where I'm going with this, where this change is going to occur. So the cash price of the diagnostic test was then made available on the provider's internet website and to the employees at this much reduced rate for testing. So that's all going to change, obviously, now with the designation of the end of the PHE. So now the government is actually urging plans and insurers to notify participants and enrollees that they are changing their coverage for diagnosis and treatment of COVID-19. However, if the change is going to be material, which in most cases, I'm sure it will, especially if we're going to start requiring, pre-authorization or medical necessity for COVID testing, it's going to trigger an ERISA obligation to notify participants. Your health insurance administrator should be able to walk you through that. But a plan may have given prior notice by outlining the general duration of the COVID-19 era benefits during the PHE. So, for example, or may have given a notification sufficiently in advance of the elimination of the diagnostic testing or the introduction of that cost sharing. So those are going to have to go into place. So specifically, the health plans are going to need to inform participants and their beneficiaries of this important information on the continuing coverage or changes in coverage for COVID-19 diagnostic testing and treatment. So this is going to, begin to apply on the date on which the plan will stop providing coverage if it decides to obviously stop paying for tests, which we expect most health plans to do, or to the extent permitted by the plan, the date on which it will start applying cost sharing, requirements. So that those are when those cost sharing, prior authorization, et cetera, cannot begin until at least May 11th. And it's probably going to be longer than that, given the fact that ERISA notifications are going to have to go out to employees. So additionally, when the PHE is over, the government is encouraging plans and insurers to continue providing health benefits for services like telehealth and remote care, as well as for diagnostic treatment and testing. However, as our other presentations have covered, state laws and insurer policies are differing to the extent that telehealth services will be covered. And obviously, despite the government asking nicely for health insurance plans to, provide this testing and treatment for free for COVID-19, I don't expect many of them are going to do that. So the government is obviously urging plans and insurers to notify participants and enrollees if they are changing their coverage for diagnostic testing and treatment. However, if the change again, so 1 second here, my PowerPoint froze up on my end. So what does this mean for you all as employers, especially since many of you are healthcare providers? Well, despite the public health emergency coming to an end, COVID is obviously still sticking around. Just last week, the CDC issued guidance about a new strand that they believe to potentially be problematic as it appears to evade the protections offered by the vaccine, although serious illness is still unlikely for those that are vaccinated. So if a person gets this strand of COVID, they're obviously still potentially at risk of getting sick, and especially if this lack of protection proves to be true. Therefore, you may still have employees who are sick with COVID and are going to need to be tested before coming to work or returning to work after an illness. So you're going to want to clarify with your health insurance plans the extent to which testing will be 100% covered, or if the employee will now have cost-sharing obligations. You're going to want to do this sooner rather than later in case any COVID issues start to arise here in the spring or in the summer, especially as people are traveling more. You're going to need to consider whether you as an employer may also engage in some covering the cost of the testing, such as through paying for over-the-counter test kits or reimbursing employees who need to buy those, or otherwise keeping test kits on site in the case that an employee presents to work sick. So we could certainly help you evaluate these policies and think through these requirements. And, really you're just kind of putting those into place just to ensure, continued workplace safety. So now let's move to preventive services. During the PHE, the CARES Act required that non-grandfathered group health plans cover any qualifying coronavirus preventive service without enforcing cost-sharing requirements. Qualifying coronavirus preventive services are items, services, or immunizations that are intended to prevent or mitigate COVID-19, and that are 1, a product or service with evidence-based rating, or immunization that is recommended by the CDC. In the CARES Act's final rules that were ultimately published, it made clear that immunization is included in the definition of coverage, regardless of whether it is recommended for routine use, and incorporates the statutory definition qualifying coronavirus preventive services. The plan was also required to provide cost-free coverage for qualifying coronavirus preventive services, regardless of whether it was performed by an in-network or out-of-network provider. That's why we were basically all at the time able to go get treatment from anyone, and it wasn't going to be of a cost to us, or go get vaccinated from anyone. It wasn't going to be a cost to us because of that CARES Act. So the plan either way was going to be required to pay the provider for the services at a reasonable amount, as assessed by comparing it to the current market rates. Again, as health providers on the call today, many of you probably are aware of these policies. Obviously, the main thing we're discussing here are coverage for the vaccines moving forward, which we now believe will be recommended on at least a yearly basis for our employees. So essentially, what's changing now? Well, the requirements related to rapid coverage of preventive services still apply to qualifying preventive services provided after the end of the PHE. So, preventive services that were previously covered, COVID is not going to be included in those. So the vaccine. Statutory rules will remain in effect. However, eligible coronavirus preventive services provided after the PHE will not be subject to the regulatory obligations previously put in place. Therefore, the plans and insurers required to follow the CARES Act must continue to provide these qualified preventive services without cost sharing, including these COVID vaccines. So that's some good news for you all and your employees, that this vaccine is still going to be able to be provided to you all with little cost out of pocket. So Nothing in the preventive services regulations will require a plan to offer benefits for eligible coronavirus services provided by an out-of-network provider. However, when the plan or issuer has a network of providers in network who are able to provide, those services after the PHE expires. So what does this mean? In order to receive coverage, your employees are going to need to go to network vaccine providers. They'll need to be careful about, just walking into a pharmacy to receive the COVID vaccine, as we all once did during the pandemic, as that pharmacy may not be an in-network provider. Fortunately, given there will still be coverage for the vaccine, at least without cost sharing for in-network providers, many of your employers will continue to get the vaccine, at least without regard to the monetary cost of receiving it. In fact, just something to consider, there are employers that have developed policies with us to allow them to cover the cost to bring a vaccine provider to the office to administer the vaccine on a voluntary basis to employees, which obviously encourages and makes it convenient for employees to get the vaccine and, keeping your workplace, healthy from, an illness that's, highly contagious and does, cause some downtime. So next, I want to shift to some extensions that were previously put in place for plan enrollment. During the PHE, your employees and some ex-employees in some cases had extended periods of time to enroll in certain programs, typically allowing for at least a year for enrollment in most cases, rather than the standard timelines such as those that are on the screen now. The big one that's going to come in for most of you that you're going to think of is COBRA extensions for enrollment into COBRA. Obviously, COBRA continuation coverage election period is 60 days, pre-COVID. We extended that out to almost a year during COVID. That's going to revert back to your 60 days. Again, your plan administrator should be able to assist you with that. But this is something you're going to need to make your employees aware of, especially as it comes to adverse event or qualifying event enrollment that we're going to discuss here in a moment. So what is changing? The emergency relief notice extensions for periods that started during the PHE are no longer valid as of the last day of the outbreak period, May 11th. So while group health plans are urged to do so, nothing in the code or ERISA prohibits them from, giving employees and participants more time to enroll. Again, that's for your administrator to work through, but I'm sure none of the health insurance plans are going to voluntarily extend enrollment periods for your employees, and you may not want them to either. So just something to consider when it comes to deadlines and letting your employees know, hey, we're going to be reverting back to the pre-COVID deadlines for enrollment, COBRA, things like that. So where is this really going to come into play and have a really an immediate effect to employers is concerns Medicaid. And Medicaid and well, specifically during COVID, many people were granted extended health insurance coverage, typically through Medicaid. So what many of you may not know, but through at least March of this year, Medicaid generally has not canceled anyone's coverage for the last 3 years. This is likely to change moving forward. I think most states will revert back. But many people on CHIP and Medicaid, therefore, are no longer going to be eligible for Medicaid because they had, eligibility during COVID, but were never removed from coverage. So therefore, many of these people will need to transition to current employer-sponsored plans or go out on the marketplace if their employer does not provide coverage. So think of a situation where an employee is laid off during COVID, as so many were, and seeks out a Medicaid plan for coverage, and they just so happen to remain on that Medicaid plan, despite now having employer coverage available to them. These are the people that we're talking about, the people that are going to really have this coverage change. They're expecting it to be hundreds of thousands of employees that are really going to be impacted by this. So for this reason, individuals who lose coverage due to ineligibility will be granted a special enrollment period coming up to enroll in an employer-sponsored group health plan for which the individual is otherwise qualified. So essentially, your current employees must be given this chance to open enroll in your plan, even if they previously turned down your health insurance when offered because they had other types of coverage available to them, such as through Medicaid, that they've now subsequently lost. So if an employee or their dependents lose their eligibility for state Medicaid or CHIP coverage, they must be given the special enrollment time. So in the upcoming months, Again, the eligibility for Medicaid for hundreds of thousands up to a few million people around the country will be reevaluated by Medicaid. Depending on your employee demographics, this could lead to an increase in the number of employees that are on your health insurance, which employers will need to be especially mindful of for planning purposes, especially if you're working on rates now with your insurance carrier. So you're going to want to get with your administrator here soon if you have a suspicion that you have a lot of people, or even just a few number of people that have health insurance through you, or were offered health insurance through you, but denied it because of Medicaid or CHIP coverage. Again, they're going to be losing that Medicaid or CHIP coverage since they're going to be employed with you. So let's go to the next slide here. Employees are eligible for this special enrollment in your group health plan if the employee meets these following conditions. So they're otherwise eligible to enroll in the plan, assuming they're full-time equivalents, and if you have that policy in place. They are enrolled in Medicaid or CHIP coverage, and they are now able to show that the Medicaid or CHIP coverage was terminated because of losing their eligibility for that coverage, which again is going to occur over the next couple of months. So in these situations, the employee normally has 60 days after the end of Medicaid or CHIP coverage to request coverage under your health plan. But under the emergency relief notices that were released by the Department of Labor and the IRS, people who lose their Medicaid or CHIP coverage between March 31st, 2023 and July 10th, 2023 are qualified for relief and may request a special enrollment in your group health plan. So they actually have 60 days to enroll as well. So importantly, Medicaid and CHIP coverage has benefited numerous employers and employees alike. Employers particularly enjoyed their lower health insurance rates and premiums as fewer people were being enrolled in their plans. Therefore, the government is asking, but obviously not requiring, that employers take some steps to assist employees during this process. For example, employers can collaborate with their plan to prolong the special enrollment period past the minimum 60 days mandated by law. It's possible that some of your employees have moved. It may not even get that Medicaid de-enrollment notice. So just giving them that opportunity to extend that period, but again, not required. Your administrator will be able to help you make that decision. But employers are also urged to ensure that their benefits team members are informed about the impending restart of Medicaid eligibility determinations. You can have a bunch of people in HR who handle your benefits who need to be ready for this possible influx of new enrollees coming over from Medicaid. Also, employees enrolled in Medicaid or CHIP coverage might be encouraged to update, again, their contact information with their state agency, just to make sure they get those de-enrollment notices. You might also encourage employees to reply to government communications right away to ensure, again, there's little to no lapse in that insurance coverage, and it makes things easier for your HR team who are handling that benefit enrollment. But again, these are not requirements, just suggestions to consider, from a business management standpoint. So let's shift over to what employers should do now. Employers and plan sponsors should really think about how the emergency period's expiration may affect their plans and what steps to take, such as considering, amending plans, amending notice periods, amending enrollment periods, and clarifying COVID's treatment coverage with your employees. That way there's no surprise. We're all under this impression, if you had COVID, you weren't paying for anything, right? But it's obviously changing now. Having your administrators, plan sponsors, et cetera, send out notices to your employees highlighting or summarizing these coverage that will now apply for COVID testing, treatment, vaccination, et cetera. Also, when it comes to extensions for your employees, don't forget that they're not only beneficial to you, but as I had mentioned, they are beneficial to your HR staff that is handling that benefit enrollment. So you should also use this time to review your COVID-related policies. Many, even as they are unrelated to insurance, right? Many of you implemented leave policies, testing requirements, COVID vaccine mandates. And although there are still just a few states left that have COVID leave requirements, such as Colorado and Arizona to an extent, just as an aside, California has expired on 12/31. The federal government's leave requirements no longer apply. And obviously, most states that you're all in with similar requirements have expired long ago. Therefore, you're going to get these policies off of your books, out of your handbook, cetera, to ensure that there can be no claims for breach of contract. You don't want an employee coming to you with COVID, in 3 months saying, hey, I looked at my handbook, I still get, 2 weeks of paid leave for COVID. I need that 2 weeks paid leave. And you're like, oh, well, sorry, the PHE is over, the pandemic designation's, concluded. You're still likely going to have to pay out that 2 weeks because you were providing it to, your employee in the handbook, which employees in most states can use to make an argument for breach of contract. So we want to avoid that. We want to kind of do an audit of all COVID-related policies, see what we can change, see what we can take out. Another thing to consider is many employers implemented work from home policies that were very relaxed as to who could work from home, right? Many employers have now revisited these plans and policies and evaluated who actually can efficiently and effectively perform their jobs from home, obviously requiring many employees to return. So you're going to want to review all applicable policies, in conjunction with your work from home to consider to what extent you're going to return your company to, pre-pandemic work from the office, pre-pandemic policies. Now, before the start of the presentation today, I did tease a major announcement that was made just this week. So, and honestly, this announcement came after the drafting of this presentation, but I still want to get you this information as it's going to apply to most of you on the call today. So I did want to announce for the first time to everyone today that as of 2 days ago, the Biden administration has officially ended the 2 remaining COVID vaccine mandates. The 2 that remained were the federal contractor mandate and the CMS healthcare provider vaccine mandate, the one that's going to apply to most of you. Interestingly, the contractor mandate was never actually truly enforced because of court decisions. That will actually end officially on May 11th, next week, which coincides obviously with the formal end of the COVID public health emergency. However, the CMS mandate will actually take some more time to unwind and end. And that one actually was enforced as it was implemented through the formal rulemaking process as the courts had required. So now because the courts had required that formal rulemaking process, they now have to unwind it through the formal rulemaking process. So we don't expect that to officially end on May 11th. It's going to take some time, probably at least 60 to 90 days. However, we do not expect really much enforcement in the interim from CMS anymore through those state agencies that were assigned the responsibility of enforcing the vaccine mandate. But many of you still have these vaccine mandates in place as a result of the CMS requirement. So to the extent you have these in place, we want to get those reviewed, get those vaccine mandates eliminated if that's what you want to do. But you're going to need to consider, especially when it comes to vaccines, whether you're going to keep those in place moving forward. Some employers will. Especially those that really had, flu vaccine and hepatitis vaccine requirements pre-pandemic. They're likely just to add COVID to that list. And they can do that, subject to the Title VII religion and the ADA protections available to employees. But we can certainly help you answer any questions you may have if you do want to move forward with implementing an ongoing mandatory vaccine policy. So now, before we get you to your questions, I do wanted to remind you that BMD is once again hosting our Healthcare Innovation Summit. This year, it'll be located at the beautiful Lake Nona Wave Hotel in Orlando in February. And I can't think of a better time for us to escape the cold of the northern states for some great networking in the warm and sun. This summit brings together some of the biggest names in healthcare entrepreneurship and features presentations from many healthcare industry leaders and innovators. This is a conference you actually don't want to miss. So with that all being said, I really appreciate you all for joining our presentation today. And I wanted to get to any questions that you all may have.